There's no silver lining to be found in 14,000 lives lost in this country. Only the hope that these will be the worst days we will see. The staggering daily toll of deaths in New York State alone rising to a new high of 779 today. But that, say experts, is a reflection of where we were weeks ago with this virus. Because by other measures, a promising trend is taking form as we also begin to understand the effects of the uneven responses to the pandemic. Our global team is standing by, and Gabe Gutierrez leads us off now from New York.
Tonight in New York, the curve is flattening, but the death toll is still rising. Coronavirus killing at least 779 people in 24 hours, the pandemic's deadliest day again. But hospitals, ICU admissions, and intubations keep leveling off. Authorities are urging New Yorkers to keep social distancing, even as Passover begins.
We have to beat it back, not open the door again too early for it to resurge and hurt so many people.
There's now growing scrutiny over whether state and local officials here were slow to act. Other cities in California and Washington state adopted stricter stay-at-home measures and closed schools sooner.
I think New York was early, and I think the actions we took were more dramatic than most, and frankly, were criticized as being premature.
Public employees are being hit especially hard. In New York City, 41 transit workers have died. So have 14 members of the NYPD. More than 2,000 officers have tested positive, and more than 500 firefighters.
We have 2 patients with possible fever cough.
Every day, there are record-shattering 911 calls. Paramedic Phil Suarez is swamped and noticing several people infected per household.
There's multiple people sick in the apartment, and that tends to be usually middle-aged men and some of the parents or grandparents sometimes that live with them.
So many are trying to help. One man driving ventilators to a hospital in Connecticut. Others who have recovered from the virus donating plasma. One man organized a plasma drive. More than 240 people showed up.
It's Passover, and in the Torah it says, you save one life, you save the world. We save 1,000 lives, we saved 1,000 worlds.
Right now, many worlds need saving. In neighboring New Jersey, Laura Sacconi's husband Lou was taken off a ventilator this week, but he's still in the ICU.
He can't eat, he can't speak. The nurse yesterday was able to get an iPad into his room, so he was able to hear my voice for the first time in 17 days. But it was just really hard to see him like that.
Among the lives lost, Rhoda Ruiz and her daughter Amanda. They died just hours apart.
The only hope that I have out of this is that she knew Amanda was gone and she needed to be with her daughter.
Alfredo Pabitao and his wife Susanna, both healthcare workers, had been married 44 years. They died at the same hospital, 2 floors apart.
They are inseparable. And whether we like it or not, my mom will go where my dad goes. And they have that love, and I want the world to remember that love story.
Here in New York, new state data shows that 86% of those who've died had underlying conditions, such as high blood pressure or diabetes. Lester?
All right, Gabe, thank you. And while social distancing measures for some communities appear to be bending the infection curve, many other areas are dealing with an unfolding crisis in nursing homes across the U.S. Here's Miguel Almaguer with that.
Tonight, as more Americans fall ill and our death toll climbs, with each grim setback, there are some signs of progress in the battle against the coronavirus. Because of social distancing and orders to stay home, doctors at the White House believe our national death toll may not climb nearly as high as once projected.
Just keep believing. I told her, don't stop fighting. Keep fighting.
Jonathan Curtis says his girlfriend, Allison Brown, a mother of 4 of Cincinnati, beat the odds after spending 12 days in the hospital fighting for her life.
I beat a deadly disease, and I live to be able to tell the positive notion that people do live. People, there is life.
While early research suggests in more than a dozen states, including Ohio, where Brown lives, there could be a decline in the number of new cases, in many areas of the country, the situation remains dire, especially inside nursing homes.
And he loved his grandkids more than anything.
At this Pennsylvania facility where Carrie Boyer's father Earl lived, All 450 residents and 300 staff members are presumed to have the virus. Earl lived for his family, but died without them by his side.
It bothers me a lot because a stranger held his hand while he was dying and not me.
Tonight, all across the country, heartbreaking scenes like these are unfolding at nursing homes. In Massachusetts, it took the National Guard to carry out COVID-19 testing for those most in need of help. In Southern California, more than 80 patients at this hard-hit facility were evacuated after employees failed to show up to work for a second day in a row. And at a Michigan nursing home, after Luann Deegan died when contracting the virus, her family discovered her haunting plea for help left on an Alexa.
Alexa, help me. I am in pain. I have to find a way to relieve it.
With no region immune from the virus, our country's smallest communities could pay the highest price. COVID-19 has now reached more than 2/3 of the nation's rural counties, with 1 in 10 reporting at least one death. The lucky life-flighted to larger cities, where a wave of patients continue to arrive. In Sacramento, the California National Guard urgently packing ventilators for Illinois, where the state is seeking 12,000 body bags.
So cover up, save a life. It's that simple.
After enacting social distancing rules early, the mayor of Los Angeles was joined by the mayor of Miami, soon requiring employees and patrons inside essential businesses to wear masks, including at grocery stores.
Tyler Perry is taking care of your grocery bill today.
And just when many needed a little help, movie mogul Tyler Perry paid the tab at dozens of supermarkets for senior shopping in Atlanta and across Louisiana, a gesture of kindness for the most vulnerable in need of a hand.
The nation's top doctors say there are positive signs for a turnaround in cases by next week, but warn it could be followed by a deadly wave of new cases if social distancing measures aren't followed. Lester?
Yeah, this virus exceptionally cruel. All right, Miguel, thank you. Now to the financial pain. Congress and the White House saying they'll need to approve another $250 billion to rescue small businesses on top of $350 billion already approved. Many are still having trouble applying while others wait for their checks. Here's Tom Costello.
In Carbondale, Illinois, Dirk Borgsmiller has done the paperwork and is now hoping his emergency government loan will be approved. His 2 businesses shut down, a gym and several wedding venues. He plans to use the rescue money to rehire his employees.
It's emotionally draining, it's mentally and physically draining, and I pray a lot. But that's about all I can do and prepare to open back up hopefully sometime soon in the future.
Nationwide, many small businesses desperate for cash are waiting. The government says it's already processed hundreds of thousands of loan applications worth billions of dollars. But many banks, big and small, have been slow to write the checks, some requiring an existing relationship with businesses to process the loans. A frustrated SBA official on a leaked Zoom conference call obtained by NBC News.
Some of the big banks that had no problem taking billions of dollars of free money as bailout in 2008 are now the biggest banks that are resistant to helping small business.
In fact, those 2008 bank loans weren't free. Today, there are some 30 million small businesses nationwide. The government says the loans won't have to be repaid if employers retain or hire back employees. But many lenders fear they'll be left holding the bag if the loan isn't processed properly or if it turns out to be fraudulent. Bank executives tell NBC News the government's loan regulations